Healthcare is in the midst of a digital revolution, and it's generating an ocean of data.
There's loads of health data out there. Patient records that have been digitised, gene sequences, medical images, lab tests. And then of course there's the sensors that we're increasingly wearing on our bodies, whether they're Fitbits or earbuds or Apple Watches, or maybe just your own mobile phone that you carry around with you.
Now, some of the tech companies that made those devices are eyeing up the data they're collecting.
Microsoft and Walgreens in a 7-year deal, and it includes up to 12 digital health centers.
Alphabet, the owner of Google, has made an offer to acquire Fitbit.
These companies have made vast fortunes from processing, managing, and mining data. Today, they're turning those talents to healthcare. But will that make you feel better?
You need to record at least 10 finger movements, and combined with those data, it will give you this score.
This app is designed to monitor a patient's Parkinson's disease just by using the camera on a smartphone.
This is a test that traditionally you're doing it in the healthcare settings in front of a neurologist.
It's been created by a tech startup called Meadowpad. Dan Vedat is its boss.
With a phone like this, I can measure my resting heart rate. I can measure and do a test for Parkinson, a test for Alzheimer. Can we look at some of the popular...
The app tracks the patient's symptoms so that doctors know when to intervene, rather than waiting for the patient to come to them.
We think there's a new category in medicine which is based on all the data that your body generates. And the whole idea and our focus is to see, can we find signatures that quantify your health, quantify different diseases you might be dealing with.
These invisible footprints are called digital biomarkers, and you're leaving them wherever you go, through watches, wearable technology, and smartphones. There are already thousands of diagnostic and monitoring applications targeting a host of different conditions and diseases.
Healthcare is all about the data. This digital biomarker category, probably it will have the biggest impact in medicine because of the amount of data it's going to generate.
Combined, the digital biomarkers produce big and potentially very valuable data sets. And that's just the tip of the iceberg. Factor in the vast volume of data already generated by healthcare systems in the daily effort to look after patients and populations, and there's the potential to improve outcomes on a far bigger scale.
There's a whole bunch of things you can do just with a much broader and deeper view of a patient through digital health records. You can pick up medical errors, for example, and you can also figure out which pathways of care are most efficient. It's only by assembling lots of patient health data that you start to see what spending is useful and what spending isn't. But in many health systems, what you find is you have pools of medical data in different places. And it's not until that you link these up that you can really wring out the power that they have to kind of give you really wonderful insights.
Digitizing and linking this data enables patterns and trends to be spotted. But it's a big job, and the evidence suggests that many countries have a long way to go.
Healthcare systems have been quite slow in using modern technologies to revolutionise themselves. Some people say that they're about 10 years behind other sectors.
In 2017, the OECD, a group of mostly rich countries, judged how ready its members are for a revolution in health tech. It looked at two factors: technological readiness, meaning digitised records that can already be used for monitoring and research, and policy, the extent to which governments facilitate the use of data in these digitised records. Some countries, like Slovakia, have the technology ready but are held back by government lagging. Others, like Poland, have more policy in place but less technology ready. And even though many OECD members have a high proportion of health datasets digitised, only a small percentage of them are regularly linked with other sources of information. Take Singapore. Although all of its key national health datasets are available, just under a third are linked, making vast quantities of data redundant.
The reason most OECD country health systems don't clean up their data sets, or at least that they haven't so far, is really that the data that exists in the healthcare system, it's not really there for this purpose. The point of it is to look after human beings in the moment.
Inefficiencies in health services and failure to make full use of digital technologies mean that rich countries are wasting up to $600 billion a year. That's around 8% of current health spending, and more than the equivalent of the GDP of Sweden.
At a time when all of the OECD healthcare systems are struggling under a burden of increasingly old patients, lower amounts of money flowing into the system, there's just not a lot of money there to do the kind of digital reorganization that is needed.
Enter big tech, with its massive computing power and expertise in data analytics. And it's very keen to offer its services to overwhelmed healthcare systems. Microsoft is providing American healthcare systems with AI tools to analyze health data relating to surgery outcomes and cancer therapies. Google is working with Ascension, one of the largest American health firms, to create an online tool so that its doctors can more easily search patient data. And in the UK, Google has been working with the Royal Free, a London hospital, to identify patients who are most at risk of falling seriously ill in hospital.
When big tech companies work with hospitals, you can start to see the potential for some really big wins. But at the same time, there are also risks. Just because a tech company says that it can do amazing things with your data, doesn't mean that it's going to work. Health systems really have to kind of think hard about patient privacy and security of the data. For example, Google got into hot water when the Royal Free shared patient data with it in a way that it shouldn't have done.
This tension goes beyond big tech's access to existing patient data. The aspirations of some of these companies continue to grow, fueled in part by their ability to collect health data directly from the public.
It's now the private sector trying to show the government how to do it.
Amazon finally making that big foray into the healthcare industry, announcing earlier its partnership with Berkshire Hathaway and JP Morgan to form a healthcare company.
Apple is using the Research app on its iPhone and watch to conduct medical studies with academic institutions. The ambitions of Verily, Google's sister company, seem even greater. Its goal is to become the central repository for health data worldwide, a kind of medical Google Maps.
If you think about Google Maps, it was an effort to really understand all of the roads, not just in your backyard, but really in the whole world. And in many ways, healthcare has some similarities. We have to understand the system, but also as a patient, you have to understand your health at a very deep level. And so when we think about projects, for example, like Project Baseline, where we're trying to map human health, this is going to be a new ground truth to understand comprehensive health data.
Project Baseline analyses health data to discover clues that can predict disease, creating a research platform that Verily hopes will enhance clinical care. Camilo Bocinas is one of its volunteers, paid to undergo a broad range of tests over a 4-year period.
There are a lot of reasons why to do this. I've got 2 children. And one of the ways I've thought about it, if something happens to me in the next 5 years, then there will be this real-time log of information about me.
This first test is called the forced vital capacity. What we're measuring is how much air you can take in and how fast you can blast it out. Deep, 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 deep. Blast it out. Blow, blow, blow. Keep going. Don't stop. Deep breath in.
Many of these tests will be familiar to anyone who's had a health check. The difference is what Verily does with the results. The data the company is collecting, clinical, behavioural, psychological, and even molecular, will be analysed in an effort to build a comprehensive baseline of good health.
This data will be anything from genomics to patients' experiences, but having this information hopefully will do 2 main things. One, it helps us as a community to create an infrastructure to actually handle all that data. And then secondarily, the idea is to try to look for signals of changes in health before disease actually happens.
The end result could be an invaluable asset for humanity, but also a pretty valuable one to license in the multi-trillion-dollar healthcare market. It's this mix of idealism and opportunity that makes many people uneasy, especially when the prospect is raised of these same companies having access to the data in their own medical records.
The issue that all of the tech companies face is that they're now so big and so prevalent that they've kind of taken on this negative, scary connotation. The idea that any of them might have my patient data does not play well with the public.
A survey from 2019 looked at how willing Americans are to share their information. It found that, unsurprisingly, people are most happy to share health data with their doctor, but far less willing to share with pharmaceutical companies or the government, and least of all, with tech companies.
Privacy is contextual. It's about the expectations that the user has over the data that they provide. And in a healthcare context, what it usually means is that I'm happy to share this with my doctor, but I'm not happy to share this with advertising companies that my doctor wants to make a bit of money on the side from by selling my patient profile to them.
Health systems and governments eyeing the benefits of partnering with big tech have a delicate balance to strike. To reap the rewards, they'll need to ease public fears about what happens to their data. That means taking the lead to ensure patient privacy is protected and demanding greater transparency about the use of data.
There are potentially huge rewards for health systems that welcome technology companies in. They can improve care, they can save lives, they can save money. You also need to think about what happens if tech companies aren't welcome. Are the health systems going to develop this technology for themselves? And if they don't, what is the cost in human life to those things not happening?
If you'd like to find out more about how technology is transforming healthcare, click on the link opposite. That'll take you to a special report from The Economist, where you'll also find some of the data and research we used to make this film. Don't forget to like and subscribe. Thanks so much for watching.